Hey guys, Dr. Ben here, folks from Medicine Center is excited to talk to you today about diabetes, about blood sugar, about things that we see with patients every single day. And this is very, very important because I always think about this, that we could reverse or repair probably 90% of the chronic conditions in this country. When we're talking about diabetes, of course, but we're talking about cancers, heart disease, Alzheimer's, all of these different things have the potential to be prevented and to be reversed if people start stabilizing their blood sugar. That's why I wrote the book, Blood Sugar Doesn't Lie. We'll post that link down below. Great read as far as just simple and to the point, gets you the ideas of why we need to stabilize our blood sugar. So Brittany's going to post that down below. Thank you. All right, so if you've got any questions on blood sugar at all, pop those down below. Love hearing your guys' questions. Speaking of questions, we're having our live Q&A Thursday morning at 8:30 Mountain Standard Time. We've seen people all over the world on there asking questions, all types of things about immune system, about health, all types of things. So jump on there as well. If you haven't already, like or follow our page, hit that little button there, and there's a little star up in the corner that will tell you when we go live and let you know when we're going. Usually I try to get out here in the morning after I drop the kids off and just jump into the office and give you guys some good information. So here we go. I posted yesterday a screenshot of one of our patients' blood work. She just came back from June to September, not even 3 months. She went from 7.0, which is full-blown diabetic, doesn't matter who you're talking to, they would call that diabetes, full-blown diabetic, insulin over 130, full-blown insulin resistance, major issues, and in less than 3 months she went down to 5.6 and her insulin was down in the 20s. Amazing changes, and yet this is what we expect to see. We see it all the time with patients. I say diabetes, type 2 diabetes can be reversed in as little as 6 to 8 weeks. And so one of the big things that people asked was how? Well, what did you do? How did you do this? How did these people make these changes? And one of the first things that you have to look at is you have to look at glucose monitoring. And for years we've had patients poke their finger and they check their blood sugar and then they write it down and we go, okay, do it at 45 minutes or an hour, hour and a half after that meal, do it in between meals, first thing when you wake up, all these different times, and you start learning when your blood sugar is going up and when it's going down. And when it goes up too high, look back at what you ate and you say, okay, what should I eat differently here? Was it the bacon or the eggs or the piece of toast? And then you go through and it's basically feedback, reward, feedback, reward. You do more of the good stuff that gives you the reward that you want, which is the blood sugar in the range that we want to see it. Hey Kim, great to see you in Michigan there. So now we use a continuous glucose monitor, which is just total game changer. For years we were able to reverse diabetes. I've got a patient who lost 110 pounds. We saw him a couple months ago, finished up care, lost 110 pounds, went from 7 point something down to 5 point something. Huge change as far as that goes. Basically, we can do that with a finger prick. But now we've got the continuous glucose monitor where we'll put it on the arm, put it on the abdomen, and we'll be able to see every 5 minutes. That will go over to your phone and tell you exactly where that blood sugar is. Every single one of our patients that starts care with us, whether you're local here or in Nashville or in anywhere else in the country and we work remotely with you, we are able to start with this continuous glucose monitor and get this information out to the masses because it is an absolute game changer. If every single person had a continuous glucose monitor on their body for like a year, which really if the government wanted to invest in healthcare, you could do that for under $1,000 per person, and we could reverse diabetes, we could reverse cardiovascular disease, all these different things. If people would use these on a regular basis, it would be an absolute game changer. Hey Leah, good to see you. Yes. So, will they come down in price? You know, it's interesting, Leah. The continuous glucose monitors. If you have type 1 diabetes and you go through insurance, it's like $2,000 a month. We've got it down to about $150 per month for that continuous glucose monitor. So, if any of my current patients or past patients are out there and you haven't had the chance to use one of these, it's about $150 a month. For anybody that's would be a new patient, it's just included in your care plan, and we just walk people through this process. But yes, it's an absolute game changer, and it's one of those tools that just I would have a really hard time practicing medicine without having an idea of what blood sugar is doing. We're able to figure out what's creating inflammation, why people are gaining weight, why their immune system may be out of balance, why they may be having some inflammatory reactions from foods. A lot of different things we're able to see. Hey Nancy, there's multiple ones out there. We use the Dexcom 6. Is what we use. It's prescription only, so that's the thing at this point. The continuous glucose monitors are prescription only, so you have to have a prescription and get it through the lab that way, or through the pharmacy. So it's challenging for most people to get them. That's why we've gone to lengths to really figure this out, how to do this. Mary, great to see you there in northern New York. All right, so let's get into this. How do we reverse diabetes? How do people's bodies heal from this? So remember, diabetes is not a thing. It's not this thing that you get to where, oh, now my body's screwed up enough, now I'm diabetic. That's not what's happened. Think about it as this continuum, as this gray scale of kind of like high blood pressure. So sometimes your blood pressure is up higher, sometimes it's okay, and somebody takes medication and maybe calms down a little bit. But blood sugar is the same way. Your blood sugar sometimes could be 180, other times could be down at 80 or 90 or 100 or even 50 or 60 if somebody's going really, really low. So blood sugar is a continuum. It's not this thing that's static and you're like, oh, now I've reached diabetes. So even if you're in the pre-diabetic or diabetic range, that's not a thing. It's not like, oh, now I have cancer and you got to cut it out of me. That's not what's happened. It just means your blood sugar is averaging too high. Okay, simple enough. Let's change the average, and then you're not diabetic. And that's what we do all the time. How do you do that? You do that by figuring out what is causing that blood sugar to go up and what's causing it to go down. It's not just about diabetes and prediabetes, why we use the CGMs. We're using that on everybody because we want people nice and steady. A lot of people aren't diabetic, but their highs are as high as diabetics and their lows are as low as hypoglycemia people. And they're swinging all over the place, and that creates lots of inflammation. So we've got to get that blood sugar as steady as we possibly can, and we're going to keep that there by what we're putting in our mouth. And so you do more of the good stuff, less of the bad stuff, and all of a sudden somebody goes from 7.0 on their A1C down to 5.6 in less than 3 months. No longer even pre-diabetic. This patient that we worked through, her insulin resistance is almost reversed. Huge changes through there. I could have shown you the entire blood work, and there's, the liver's improved, the inflammation markers, all these different things have changed, and it's like, wow, that's pretty amazing, and yet we see it every single day. And this wasn't with supplements, so we didn't use blood sugar supplements, we didn't use metformin, we didn't use any of these agents that would try to pull down blood sugar. We just used what she was putting in her mouth. So that's the food side. And then we look at, Mary, mine is low as hypoglycemia. Yeah, and so even the hypoglycemia, using that continuous glucose monitor is still a huge boon for that, because a lot of people don't realize why they're crashing down. So here's what we're looking at. Diabetes is not a thing. Prediabetes is not a thing. It's a range. It's a gray area. It's a continuum, and we're going to go through and really calm down that blood sugar spike there that's going on. And so you do less of the bad stuff, more of the good stuff that's keeping it in the good range, and your diabetes starts going away. Sure, with this same lady, she had liver enzyme issues, fatty liver. She had inflammatory markers. She had her ferritin was high, her triglycerides were high, so we had to go through and support the liver. We did a liver cleanse. She had some gut infection things going on, so we did some kill off. We brought in some probiotics. She had some signs of leaky gut, so we had to work through healing up that gut lining. We had to go through and do some work on the inflammation, some turmeric, some fish oil, some different things that are going to help with that short term, but long term, if you don't fix the why that somebody has this inflammation going on in their body, there's no way they're going to be able to get it dialed in and be as healthy as they possibly can. So we were able to help this lady. She reversed her diabetes without supplements for blood sugar. I haven't used a blood sugar supplement in years. You're not going to find that in my book, all these recommendations on supplements. But what you're also not going to find in my book, Blood Sugar Doesn't Lie, is a diet, a menu, a meal plan, because everybody is unique. Some people, sweet potato is worse than white potato. Have you ever seen that? Some people, oatmeal makes them hit like 180, even though they say oatmeal is good for you. Some people, they can't have quinoa, or black beans are bad for them, or certain fruits they can have or can't have. It is very, very confusing if you're just looking at, oh my gosh, how am I gonna get my blood sugar stabilized? But it's not confusing once you get that glucose monitoring going on. Hey Gail, excited. We're going to go over everything with you tomorrow and show you how perfect, well, maybe it's not perfect, but we're going to show you exactly what's going on and take you by the hand and get you through that process. So even if somebody is pre-diabetic or diabetic and they come in, I'm like, that's great. We can reverse this. We can change this. We can get that blood sugar to come down. So even to say reverse diabetes isn't really a thing, because diabetes didn't like, okay, now it's this disease, but all we're going to do is get that blood sugar down into the right range, kind of like blood pressure. So if you start losing weight and exercising, somebody's blood pressure naturally comes down, they get off their medication, and it's not like, ooh, you healed their blood pressure. No, you got them healthy, and now the blood pressure's down, and that's what happens with blood sugar. Same thing. You get somebody healthy, you get them figured out on what they need to be eating, and then their weight starts coming down. Remember, weight is a symptom of ill health. Weight is not the cause of ill health. So we've got to take a step back. We've got to go piece by piece through this, fix whichever systems are out of balance. Start with the blood sugar, but then we've got to go through liver or gut or inflammation or thyroid or whatever else is going on. We've got to go through hand in hand and take you to that place where people are able to reverse their diabetes and get their life back. So check out that post from yesterday, 7.0 down to 5.6. We see it all the time. For us, it's kind of like, hey, that's cool. For Nashville, it was actually one of the first blood work re-exams that we had gotten back in there, and so they were pretty darn excited about that. But we've been doing that for years, and we're like, you know what, this is great. This is what we see. We expect it to be fixed every single time. That's our goal. So if you've got questions at all, drop those down below. Otherwise, listen in Thursday morning, 8:30 Mountain Time, and we're going to be doing live Q&A. Send over some questions, or at the time of the video, pop those in there, and I'll be answering as much as I possibly can and giving you guys those tools to be as healthy and strong as possible to fight off anything coming your way, because we know it's coming. We know there's more coming at us, and we've just got to be as strong and vibrant as we possibly can. So you guys make it a great day. Stay strong out there, and we'll talk soon.